Basically, we're all soldiers in this marathon. This is going to be going on for some time. Right now, we're in the acute phase where there's war and immediate needs, and there'll be reconstruction phases as well. There really is a role for everybody to play. We do have a way for you to register your strong desires to go to the homeland, and that would be to email volunteer@AAHPO.org. By doing that, we'll put you in touch with the appropriate people from the Armenian Medical International Committee that has an ongoing needs assessment of what the needs are on the ground. And by registering your name, you'll be called when the time is right for you to go back. If you're John Q. Public, an American citizen, any citizen that wants to go to Armenia, we want to know who you are. We do have supply chain going to Yerevan by a number of routes, but the quickest way to get goods is by suitcase. So I know our colleagues in Boston have been doing this. We're going to be doing this as well in the New York tri-state area. Suitcases ready to go, one suitcase per traveler. And we have made arrangements with the appropriate people at the airport that there should not be any problems with customs or any other security apparatus when you get there. So again, we need those volunteers. Medical supplies, we all want to donate to a cause. And I can't tell you how much Tylenol, Motrin, and Advil is sitting in a warehouse in California. People have called me and said they're going to go to Costco and clean out the shelf. That's well-intentioned, but honestly, not needed. So we want to be smart about how we accumulate medical goods. If you have or access to medical supplies, please check with us before you obtain those goods. And you can email us at medicalsupplies@aapo.org. And from there, you'll be hearing about what supplies are specifically needed. If you want to make donations of equipment, there are priority items. So for example, personally, I have 10 pre-op chairs where people are administered local anesthesia. They can be used for chemotherapy and others, but this is not an acute item. It doesn't, even though it's needed, it's not needed acutely. There's no reason for it to take up precious cargo space on an airplane. We're going to be sending it by ship, a much slower route, much cheaper route, much more efficient route for the item that we want to procure. So again, please contact us at medicalsupplies@aapo.org. Now, the other reason for doing this is logistics and transparency. Logistics. Everything that's donated through AAHPO, or most things are everything actually is being inventoried, and that inventory is being shared with a special Google list, which is updated daily. So we know exactly what is going to be going to Armenia. For those goods that we send to California for the warehouse there for air shipping to Armenia, they are actually barcoded, and they're using a barcode system that the people in Armenia on the ground are using as well. So everything will go to California. It's barcoded, inventoried, shipped to Armenia. They read the barcodes. It's stored in the warehouse there. And then knowing what they have, they're able to ship it to where it's most acutely needed. And the other part to that, it will help facilitate transparency. I did get a call from someone yesterday who wanted to ship a respirator to a friend in a hospital in Yerevan. And he ran into a whole bunch of issues with customs and so forth, and decided that they were better off not doing that. So again, please check with us if you have any medical supply or equipment donations. I'm going to turn the program over to my friend, Vatcha Minassian, who is the Chief of Urogynecology at the esteemed Harvard-affiliated hospital, Brigham and Women's Hospital in Boston. He's an associate professor at Harvard University. He's also the president of the Armenian American Medical Association based in the Boston area. It's so nice to see many of your members here, Vatcha, and thank you for all of your terrific efforts and your daily summary of what's happening in the war. Please share with us how Boston is faring and what you're doing to help us in this effort.
I don't have much time to talk about all the things we've been doing, but I'd like to briefly touch on the highlights. And before I start, I wanted to say a poem by Baruch Sevag in Armenian, which really applies very well to the situation, at least at the AAMA. And it goes as follows. Gamk, Ashchadank, u Gorov. Երեք ցիրկերն են որով, Mart Churivra Tehori, Ambaiman Gahachori, which really translates into English, there are three virtues with which you will always succeed if you have all these virtues. And these are will, perseverance or effort, and courage. And I think the AAMA has been up to the challenge, and we have been able to meet all the needs within our community with respect to helping Armenia. So I'm gonna give you a few examples. I think the key has been my daily emails. People are thirsty for information, for knowledge. What is going on? What are we doing? How are we doing it? How can we help? And those daily emails have been very important, in my opinion, where I try to summarize everything we've done over the past 24 hours, mostly in the Boston area, and I touch on highlights elsewhere, and I share it with the group. Through those emails, we've been able to outreach to different communities. A friend of a member, for example, concrete examples, a friend of one of our members has a ventilator company. He's based in Greece, and he's giving us 4 ventilators, which have a battery supply, which can be used in ambulances as well as in the hospital. A cousin of another member who lives in Florida wants to do something. There's not much of an Armenian medical presence there. So he reached out to the Advent Health System, which seems to be a huge Christian-based or healthcare system with 50 hospitals. And he knocked on some doors, and they're giving us 2 pallets full of supplies, and they're sending a bunch of boxes and or medical necessities, which we're going to link up with our donor and traveler program that we've developed. We're seeking volunteers to send, just as Larry said, to send urgently needed supplies that need to get there within a week or less, and we can't have the luxury of waiting for airplanes or ships to take the equipment there. So we've solicited some donors who are really excited about participating. We're asking for $2,500 or $3,000 per traveler, which covers most of the airfare and the luggage fees. And we've had volunteers from everywhere. We have a nurse in Detroit who also she has the resources, but doesn't have the access to shipping and whatnot. We're trying to, connect, collaborate, troubleshoot, hook people up with each other, just for the sake of, helping Armenia as much as we can.
I think you brought up several good points. I want to reinforce to the community listening that through both the Boston and New York organizations, that we now have free trucking anywhere from Washington, D.C. to Montreal. So if there is a pallet, if there are 20 pallets to pick up, we've been very fortunate. We have several Armenians who have companies that own trucks, and they are going up and down the East Coast. And there's also a trucking company that ships free to California. We also, in the New York area, have 2 warehouses. We have a warehouse kindly donated by Harco Industries, Saro Hartunian, centrally located near the George Washington Bridge in Englewood, New Jersey, as well as a warehouse in Somerset, New Jersey, another travel hub in New Jersey by Leon Arian, the former president of the Eastern Division of the Armenia Fund. In terms of shipping, there is a cost to shipping. And we as healthcare providers can find the equipment, we can store the equipment, inventory, repair, but shipping is costly. The cheapest we can find is about $4.25 per kilo. And correct me if I'm wrong on that, Vatcha or Ara. So if there are donors that would like to contribute to either our organization or the AAMA, we're both 501c3 organizations. We very much would appreciate that. If you know of anyone else that's renting cargo planes and sending things to Armenia, please let us know. This is a very exciting evening for me. I think this is going to be an amazing speaker. I heard him speak last week. I was really so excited to hear someone who has such a strong grasp of the geopolitical situation in that region of the world, as well as what's happening here in the United States in the political realm. Van Krikorian is a lawyer, which really surprised me given his skill sets in so many other areas. He's the co-chairman of the Armenian Assembly, the chairman of the Armenian National Institute, an adjunct professor of law at Pace Law School, where he teaches international trade law. He was Armenia's counselor and deputy UN representative in 1992, chairman and CEO of Global Gold Corporation, and an executive and board member of many other companies here in the United States. I think you'll be so excited to hear him speak this evening.
I want to just start by talking about what I think is the most important philosophy to take into this. And that is that by going after some of the issues, bigger issues that control how the United States and the rest of the major countries address the situation, we do a lot of good. In fact, it's often critical. What's going on now is increasingly referred to as a chess game. For us, it's awful because the humanitarian, the family, the memories of the genocide, our identity is very much real. But if we look, for example, at Russia punishing Turkey by massively striking pro-Turkish bases in Syria, if we look at Iran using the opportunity to inject themselves into diplomacy and perhaps trying to displace the Minsk group, if we look at President of Turkey, Erdogan, trying actively to do the same, criticizing the Minsk group co-chairs, although Turkey, ironically, is one of the Minsk group countries already, and also declares itself a participant, and in fact is a participant in the conflict, clearly. At this point, there's a lot going on. There's a lot going on at that higher level other than on the ground. On the ground, what's going on is frightening enough. And you're seeing that, you're feeling it. I quite expect that, like me, you have friends that you're consoling who have lost family members, who have not found the bodies yet, who don't have contact and then are incredibly relieved when they show up. And you have family members here who are reacting in all kinds of, and friends who are reacting in all kinds of different ways, because we're seeing it again. For those of us who went through, the intense parts of the war in the early 90s, it is very much a recurring nightmare also. We can remember, when in response to the peaceful petition of the Soviet government for reunification with Armenia by the parliament in Nagorno-Karabakh, we met with these awful pogroms in Sumgait and then Baku, and then in following that in 91, this Operation Ring with the Soviet and the Azeri Oman forces essentially encircling and ethnically cleansing the Armenians and taking over territory to the point where we almost had that genocide occur there. And then when the Soviet Union fell apart, as happy as everyone was about independence, we were equally happy that, once the fight became a little more fair, Armenians more than held their own and established a security zone around Nagorno-Karabakh, not only the lifeline to Armenia, but beyond that. I think that has to be paramount in our thoughts, that what's driving the human rights issues, what should drive the political issues, as I say, what should drive the very big issues is Armenians should have the right to live in peace and security, and nobody is going to trust Azerbaijan to provide that again. They have breached every ceasefire they entered since 1994, since 2016 when we had the 4-day war, and they agreed to three things: to truly respect the ceasefire, which they began breaching almost immediately, to when they agreed at meetings at the presidential level in St. Petersburg and Vienna to also increase the observers and monitors, and then also to allow the investigative mechanism so that when there were breaches, that you know, an outside party could investigate. It's a clear parallel to Turkish denialism of the Armenian genocide, where Armenians will claim you're dropping cluster bombs on us, and the Azeris will say, no, you're dropping cluster bombs on us. Armenians will say, you're shelling our civilian areas. They'll say, you're attacking our civilian areas. We saw this all along, including specifically in 2016, when, again, against the rules of warfare, the Azeris were sending artillery fire from behind civilian areas to try to shield themselves that way by using these munitions that they shouldn't be able to use and are prohibited for use in warfare in civilian areas. I don't know if you saw the program with the Halo Trust the other day, where the Halo Trust person on the ground said these cluster bombs, which are bombs that lay down smaller munitions that work as landmines, they're sending them in these colorful red and pink ribbons, which become very attractive to kids. And that's intentional. It is disgusting as that is, it's intentional. Diplomatically, what we're seeing, it is also a reflection of how the world has changed, I think. If we moved from a Cold War period to a more unipolar period, with the United States being a dominant country, to then a multipolar period, and then a time when at least there were accepted rules of diplomacy, not just, you know, Security Council rules, not just rules of warfare, not just trade rules, but rules. You know, there was an accepted structure. With the movement to more nationalism in Europe, in other authoritarian countries, a movement to every country really just looking after its own interests and ignoring what I think made the United States its strongest, was putting its faith in a system where the rules were clear and we would want all countries to abide by those rules, including in diplomacy. What we saw was a deliberate weakening of the agreed system of using these Minsk group co-chairs of US, France, and Russia to mediate and resolve the conflict. There is plenty of room to criticize the mediators. We have done that regularly. There is plenty of room to criticize each of the co-chair countries. We have done that regularly as well. And I think you saw in Armenia and in diaspora and every place else the outrage when we found out just how much in arms Russia was selling to Azerbaijan. We see the irony of the Israeli arms sales, you know, to Azerbaijan, which have been immense, a country determined to commit genocide against Armenians, but also one that is actively using jihadists and sworn to the destruction of Israel. I don't know, and I hope you didn't see it, but I have seen, and I expect some of you have also seen, the videos of some of these jihadists standing around 18 dead Armenian bodies saying, we killed the Jews and the pigs. These sort of bizarre situations are occurring because the world has changed. And we need to find our place in that world. We were hopeful, extremely hopeful, and we were right on the edge of getting a UN Security Council resolution that would have restored order and given countries that were interested in keeping the peace the right to do that. That was thwarted by Azerbaijan, interestingly enough, by the British government on account of British petroleum and its vast investments and profit interests in that country, as well as by China. So China's involved there too. when in 1992, Turkey threatened Armenia in solidarity with Azerbaijan. We remember Marshal Shaposhnikov saying, if they do that, it will be World War III. And Armenians breathed a sigh of relief because at least Russia had us under the protection of their nuclear umbrella and their military force. And then instead, Turkey imposed its matching blockade with Azerbaijan and slowly choked Armenia and isolated it. I'll try to move more quickly and get to questions, because this area I do want to spend some time on. I know that, you know, it seems like at least most of the audience is from the United States. So from the US perspective, I think it's the most troubling. All of us grew up here believing, you know, that the US was a fair country, that the US was going to apply human rights standards, was a rule of law country, and would do the right thing. And that hasn't happened. In the last 2 years, Azerbaijan has received an extra $100 million in military assistance, in a country that is absolutely filthy rich from oil. A corrupt authoritarian leader doesn't respect democracy or human rights in his own country, is getting an extra $100 million when the clear agreement and understanding was that the United States would always be equal in its military assistance to Armenia and to Azerbaijan. We see very much, you guys all felt it last year. Ironically enough, in the fall of last year, when Erdogan was given a green light to go against the Kurds, it removed some of the barriers that had prevented us from years from passing the genocide resolutions. And we're all happy about that and acted as quickly as we could. But the green light that Erdogan received and continues to receive to intervene in this war, both with his commanders leading Azeri troops and also by importing jihadists to fight against Armenians. You know, I know also that many of you are either in New York or from New York, and I've made this point before. We very much remember, for those of us who were in Manhattan that day, 9/11, and that all Americans, we feel, are against terrorists. And here is a US NATO ally paying for terrorists to travel from Syria and Libya into Azerbaijan to kill Armenians. And you know, doing it gleefully. There are US laws, there are treaties that are supposed to punish countries for doing that, and those are going unenforced. Section 907 of the Freedom Support Act, which I had the honor of writing and passing through Congress, negotiating the final terms, says that the United States cannot give any aid to Azerbaijan except some little humanitarian aid unless Azerbaijan ceases aggressive military activity and blockades not only against Armenia, but also against Nagorno-Karabakh. Now there's a waiver provision, and this year in March, Deputy Secretary of State Steve Biegun signed a waiver saying that, you know, we have to waive this provision and give Azerbaijan this assistance because it's either necessary to support US efforts to counter international terrorism, which is ridiculous because it's actually being used to pay for and foster and house terrorists who wear Azeri uniforms, speak Arabic, and tape themselves with these trophy videos, is necessary to support the operational readiness of the US or coalition partners to counter international terrorism, when again, you know, our tax dollars doing the exact opposite, is important to Azerbaijan's border security. In fact, you probably all also saw that last week, Iran started major military exercises on its border. And the fact is the Deputy Foreign Minister of Iran, I think it was in Baku today and will be in Armenia tomorrow, is doing his own rounds of discussions, has his own peace plan. Erdogan has his own peace plan, which is, just impossible to imagine. And then finally saying it will not undermine or hamper ongoing efforts to negotiate a peaceful settlement or be used for offensive purposes against Armenia. Now, we're able to trace that exact aid, whether it's material, weapons, or training, to operations that have taken Armenian lives. The exact opposite of what the State Department is signing on to. Now, having said that, I will also say, like in any group, there are good people and bad people. So our job is to identify the good people, work with them, promote them, and minimize and expose the bad people. We have had to do that recently, and this sort of gets into the public relations aspect of it. I'm just going to make two more points and then I'll wrap up. I feel like I may have gone on too much already, but this effort, you saw McDonald's, Burger King, Papa John's, these US companies that are there, but especially the killer is British Petroleum. It's BP that will be unveiling our campaign against soon. They and the lobbyists, which I expect Brian and Auntie talk to you about, some of whom are declared and file their Foreign Agent Registration Act reports and their Federal Registration of Lobbying reports, and those who are undeclared. So there's former US government officials, former other officials who may be subsidized by Turkish companies or Azeri companies, and they kind of act like they're authorities and sort of turn the tide of public opinion because they seem to be authorities without disclosing their true interests. That we need to work on, and we do work on quite a bit. You guys saw, I'm sure, the great work that organization of investigative journalists against corruption did, exposing the Azerbaijani laundromat and their payment of $2.3 billion in Europe to influence decisions there, and how $500 million of that went to the United States hasn't been accounted for. You saw a House Ethics Committee investigation of 30 members and staff a few years ago, though, that we pounded away on to expose those bad people. So, and I think everybody gets it, that's our job. To the extent you can help us, everybody should do what they're good at. That's where we need help. That's where we ask for help. And we feel like by addressing those issues, just like, for a while, we were all extremely happy when Armenia was the second highest recipient of US aid on a per capita basis in the world. Why? Not just because of the money, but it sent a strong message that the United States cared about Armenia. We have dropped substantially from that, but leveraging that kind of strength makes a huge difference. If 10 people visit their congressman's or congressperson's office, if 20 or 30 get to their Senate office directly, not just through an automated thing, but personally picking up the phone, that makes a huge difference.
Thank you so much. It really was a pleasure, a distinct honor. And again, thank you for everything.
Thank you.
The next speaker, who's going to talk about a different aspect of the war, and that's the impact on the young families or young mothers, their prenatal care, their postnatal care in Armenia. We're so fortunate to have Sam Badalian with us. Sam is a medical doctor trained in Moscow, also trained in Armenia at the Armenian University there. He also has a PhD. He has done research at Columbia Presbyterian and is now the chief of the Women's Health for the Bassett Healthcare Network near Albany. Thank you so much for joining us, Sam.
Thank you, Larry, and thank you, everybody. It's late. What happened actually in Artsakh, we're going to talk about the war and COVID-19. And what happened yesterday, it was bombed Artsakh Maternity Hospital, the Stepanakert Maternity Hospital. It was the worst thing what I ever heard. and which means the F-16 planes, they bombed specifically for the hospital because they knew this is hospital. They knew this is there the people are who delivering babies. And this was the greatest disaster and last things which Azeris can do it for Armenians. And all this news was in the media, and you can see on the slides what the hospital look like now, and which hospital was built recently, and everything is designed. I've been in this hospital, I know what's going on there, and unfortunately, this is going to need a lot of efforts to be reconstructed. And if you talk about the prenatal care in Artsakh, and I'm showing you the tweet where Nikol Pashinyan sent it yesterday around the world, how Azeri forces were able to kill all the infrastructures in Stepanakert and Sushi deliberately for maternity hospitals. I think this is absolutely unacceptable. Prenatal care, there is no prenatal care in Artsakh right now as of the war started. All pregnant patients transferred to Yerevan for deliveries. And pretty much this is what's happening right now. And since yesterday, we had 107 pregnant patients delivered in Yerevan maternity hospitals. Thankfully, there were no complications, but the patients, even sometimes they're driving by themselves in their cars with other children in the car, and they're coming to Yerevan to deliver. It's been cases when 8 delivery, 9 delivery, and our patients are trying to go faster because it takes 5 hours to drive from Stepanakert, come to the Yerevan, and the roads are not always as good as United States, but the people are able to make it and come to delivery. If this war going to continue, unfortunately, now we're having pregnant patients coming to Armenia to delivery, but many other patients other people going to start to moving to Armenia if our force is not going to be able to stand up for their land. And I'm certain every Karabakh soldier, every Armenian going to be there to stand up and be able to stand for their own lands. But because we don't have other choice, pretty much we don't have other choice. This is our land, and we need to work and we need to fight. We need to do everything is possible to go forward. This is pretty much about the war, but we have a second war. The second war, it's a COVID, which actually hitting us. And COVID-19, which is significantly different than SARS, influenza, or measles. And, more people are affected, more that we have. I'm just going to share a few slides with you, which comes from the Armenia. Those are actually old slides from the June or July, but the Armenian government in June or July were very well. They're doing a lot of changes. They were improving the numbers of cases going down. And pretty much the spike, what you're seeing actually was controlled. The number were going to the 100, 200 cases. Then war is started. Actually, people started not to use masks anymore. People started not to be as cautious as before. And we have now a huge spike. The spike is so big that we have actually crisis in Armenia, in Yerevan. We don't have enough ICU beds right now, and we're not going to be able to help those patients, and particularly pregnant patients also. What's happening right now, our bed capacity, it's maximized. I think we're going to talk to the George, which is there now, and he can confirm that we are talking about to open some hospitals as some hotels to make it as a hospital to be able to care for patients. Because we're going to face to the situation which we have in Italy, choose which patient going to be treated, who's not going to be treated by their age, by their comorbidities, which means the crisis is going forward. And if I'm comparing what was before, like in July, August in Armenia and what is now, it's a huge difference. Armenian government was very well prepared how to handle the crisis. And they were following with real-time surveillance. They were publishing which marks how many cases they have. But now everything has become chaotic. I think the healthcare is a huge crisis facing Armenia right now. And I think, tell you the truth, I don't know how things are going to go and what's going to happen right now. And I'm going to share just a few things about the infection prevention, what is coming from Armenia, actually. Their guidelines, and which is adopted, they're trying to reinforce again to asking community and people to wear the masks, which actually the only prevention right now. And medications, we don't have as much medications as we need in Armenia also. If I'm going to move to the pregnancy issues, just very quickly, I'm just going to spend a few minutes about the pregnancies and COVID, because there are 90 papers were published about COVID and pregnancy. And only one of them, which was population-based study, which was published from UK, they analyzed all the cases which involved, and actually the 195 OB cases in UK, they collected about 427 pregnant women were admitted because of COVID. And the data showed that then they analyzed the data pretty much, and they come up with significant important findings, which the majority of the patients presenting with fever, cough, and shortness of breath. And in a summary, they come up that 1 in 10 pregnant patients admitted to the COVID, they have respiratory symptoms, and 1 in 100 died pretty much. This is actually for pregnancy, at time of pregnancy. And if you compare the people who are dying, the most of them have either overweight or other comorbidities, and they are over age 35. 12 patients of the delivered patients, they delivered preterm, and the 60% they delivered by C-section because of maternal indications. This is the only study which is available right now in order to, you can just talk about it, which is as kind of the data which is acceptable for all of us. And if you talk about children, about 2% of infants that didn't have any evidence of RNA, and they're talking about transmission. It was only a few of them, they showed mother-to-child transmission, which can occur prenatally. Pretty much, I'm not going to spend time because, not all of you are in obstetrics, but there we have a lot of changes in prenatal care. I shared those slides in Armenia following all those guidelines which you have here. Pretty much you're trying to decrease the OB visits, try to decrease exposure. We're testing all pregnant patients at 39 weeks, make sure they are not coming to hospital if they have, or if they are in hospital, use the PPEs, prevent any transmission. Medications would use remdesivir, which is used, as you know, is approved for COVID-19. We don't have a lot of data about the fetal toxicity. There were data about at the time of Ebola and Marburg virus about the disease, but right now about the pregnancies, you don't have any data. Other drugs can pass placenta, and you can have some QT interval prolongation, which we are not using it. I'm not going to go specific medications. The management of the labor at the time of COVID, you're doing C-sections only by OB indications, which means COVID is not indicated to have a C-sections. And pretty much at 30, if you look the studies, majority of the studies were done. Sometimes even C-sections can be a problem, which can increase the maternal complications also. Of course, you're going to do prophylaxis for DVT because of the increased risk of the blood clots, and we're going to decrease mother-baby contact after delivery to decrease the transmission also. About the breastfeeding, there is a lot of controversy. There are some studies which showing that breastfeeding, it will be good for patients, but the more data we needed because of can be potential risk because of viral transmission to the milk. Pretty much, I'm not going to go further. I'm just going to stop there, and I'm going to take any questions. But to tell you the truth, I think the healthcare in Armenia, it's in a critical situation because of the war, because of the wounded soldiers transferring to Armenia. You have a lot of cases going on right now. Many of our colleagues are in Armenia working day and night. And plus COVID, which actually is peaking right now. Every day we have 2,000, 2,500 cases. Every day we're losing people. Today I got the news, one of our very famous professors, Dr. Davidians, Vladimir Davidians, he was head of the Department of Epidemiology at NIH. He passed away because of COVID.
Oh my God.
Nothing we can do. This is tragedy what you are facing, and hopefully we'll be able to go forward without any issues.